series. I'm Danielle Claus, the Executive Director for CMO. And today with us, we have Dr. Cathy McLellan, who's the Division Chair for Cardiology here at Kingston Health Sciences Center. And she also heads up the educational program here at Queen's University as well. So welcome, Dr. McLellan.
Thank you. So I'll just go and share my screen here.
Lovely.
Okay, we're just going on to slide presentation. Hopefully, there we go. Can everyone see that? Great. Okay. So good morning, everyone. Thank you very much for tuning in on a snowy morning, yet another snowy morning. It has to be finishing soon. So it's my pleasure to speak with you today about cardiology eConsults. I've had the pleasure of looking after patients with you in Kingston for almost 20 years now. And so I know many of you and look forward to meeting more today. I just start with some program disclosure. I have no potential conflicts of interest or any support from industry. And the goals of today's session are to identify the relevant eConsult opportunities in the specialty of this webinar, which is cardiology. We're going to integrate eConsult into the practice of the primary care providers. Many of you are already involved, and we'd be happy to have more. And I'd just like to try to help explain from the cardiology perspective how we can manage the patient needs effectively through eConsult. I thought, just as an overview of cardiology specific points, I'd just tell you again about the current options that we have for in-person and eConsults. A couple of examples of suitable eConsults, and I'd really like to focus the time today on feedback from the group and take any questions. I've personally been doing the cardiology consults just since January on the eConsult group, and that's given me an excellent chance to understand what kinds of questions are coming. And I have found it to be pretty straightforward from my perspective, and certainly a manageable additional work. So the in-person options presently, as you know, you can refer to an individual cardiologist. We have an urgent clinic at Hotel Dieu, and that was initially started by John McCann's many years ago and has evolved into really an urgent clinic assessment for primarily patients who come through the emergency room and require an urgent follow-up. It's a high volume clinic, and then we try to triage other referrals within the division. We have several subspecialty clinics as well that are listed below. I wanted to tell you who is on each of the teams that we're presently providing for eConsults. The cardiology group is more of an undifferentiated service, and that is the largest of the consults. For example, we did approximately 200 eConsults in the last 12 months. This is the group that is participating. And then you can also see the arrhythmia subgroup and the interventional subgroup, and there's some crossover between the two. I have found the interventional questions to be very low volume, and those could increase or they could just come through cardiology. The arrhythmia group also has a tremendous in-person request or outpatient request, and they have very high volumes. And this is also a service that could have increased eConsults if that would help to streamline things. So the undifferentiated cardiology group, it's really an opportunity for testing interpretation and guidance for another test, guidance about should this be in person or how often should we have this person do a follow-up echo. Those are the questions that I have often been dealing with. I've also been receiving quite a few of the preliminary arrhythmia questions through the undifferentiated cardiology group. ECG, Holter interpretation, does this patient need to be seen? The interventional one, certainly coronary disease management, and then there is increasing volumes of structural interventions in Kingston now. We are now doing closures of patent foramen ovalis in cryptogenic stroke. We are doing a high volume of transvalvular aortic valve implantation without sternotomy. And we are also now doing mitral clip. So there are niche clinics that serve these patients, but often we do receive questions through this stream, and it's a good use for that. So one of the questions that I've had before from primary care providers is, should I ask the question or just refer the patient? That's an excellent question, and really the crux of how this can be successful. My opinion is that symptomatic patients generally do need to be seen, but for the patient who will need to be referred in person, if some additional testing can be done ahead of time, that would help expedite the process and perhaps reduce the number of trips or in-person visits the patient would have to do. That is a really good use of a cardiology eConsult. So an examples would be, suggesting this test and then direct it to interventional arrhythmia and give them sort of refer it to this doctor who's doing a PFO closure is an example that I'll give you in a second. So here's two examples. The first is a young patient with an incidental finding of PFO/ASD on an echo with mild right ventricular dilation, completely asymptomatic. What should I do? And my advice was to refer them to Dr. Abunasar, who is our local expert in closing PFOs, and then he can make the arrangements and proceed if indicated or advise on follow-up. And he would need to see the patient in person, but at least this streamlines it for the referring physician so the patient is referred to the appropriate subspecialist. Example number two was a patient with a Class A license assessment, asymptomatic, but the comment was that the heart rate is often high, and wondered about an ECG, and was it just the bronchodilators for his COPD? All good questions. My advice is, this patient will need to be seen, but I suggested to order a Holter and an echo, and because the patient lived near Belleville, I suggested referring to the cardiology group there and was very specific about that, trying to just reduce the travel for the patient. But I'm hoping that that's an example just to try to streamline the testing and speed up the process for you and the patient. So for cardiology eConsults, certainly our volumes can increase, and we hope that this would eliminate some of the completely elective in-person question type patients who are on our waiting list, and then reduce the wait for those who need to be seen in person. I am working with KHSC to centralize referrals for cardiology, which is something that I have not been able to achieve in the 5 years that I've been the division chair, but we are working on it. It's just really complicated because of the multiple subgroups. So we are working on, getting involved with Dr. Eisenhower's group with the Ocean referral, and I believe the other one is Novari. So we're working on that, but I haven't achieved it yet. So stay tuned. We're hoping to do that over the next several months to a year, but we're also trying to coordinate it with the regional health information system that's coming. So for now, to try to expedite your access to cardiology, obviously, if there's something urgent, the person on call is always around. But if you just have questions, I'm hopeful and optimistic after doing this myself for 2 months that this is a service that is helpful to you. And in the next portion of this discussion, the CMO team may have comments and questions, but I'm also interested if any of you on the call today have had eConsults done. Are you actually finding it helpful? Because I don't always know that. And so I try to give advice, and then often I don't hear anything, which is completely fine if people are happy, but if they're not, and we could do it better, then I'd love to hear that. Thank you very much.
Excellent. Thank you very much for that succinct but thorough presentation. So it looks like we've got a question. I saw a hand up briefly there from Dr. Almufala. I'm sorry if I've got that pronunciation wrong.
Hi, Oz.
You're on
Oz
mute.
is our, yeah, Oz is our, Oz, you're on mute. He's our, Dr. Amufli, I can introduce to the group. He is a cardiologist who runs our heart function clinic.
Oh, welcome.
And so he will be interacting with many of you and is not quite on the eConsults, probably because I believe the general recommendation is the person be in practice for 5 years. Yeah. But Oz, did you have a question?
It was an applaud sign.
Oh, thanks.
But I would like to say that I like how you sort of, in your response to these questions, you address where the patient should go, but also what tests should they have before they come see us. And I think this is very valuable. We sometimes see patients before they have all their workup, and that ends up needing another visit. So those are patients that would have to wait longer to see me, and then we wait again to get their Holter. So I really think this is a very good venue of advising the family physician. It also gives reassurance to the patient that you know what, you're not just waiting for this, you're getting your tests and having more workup before you get full evaluation with the specialist. So I really like how you phrase that, Cathy. And now, is that standardized response, or is that your practice, or can you tell us more about that?
Well, I think that the people doing the eConsults understand that that's where we've been trying to go, but that's the point today, is I'd just like to hear feedback, if I can get it, about suggestions for referrals and for the feedback.
Thank you.
So I would say, if we've got primary care providers on the call that have had experience sending eConsults to cardiology, it would be great to hear how it's working for them and what could be enhanced in the service. Maybe while we're waiting for people to comment, could you let us know about the most common eConsults that you get right now?
Sure. So the most common ones that I've been seeing in the cardiology one are either drug medication management questions or the initial investigation of someone with a it varies from either a straightforward presentation of a symptom to not very many symptoms, but an abnormal test. That would be very common, is what should I do with this abnormal test result in a person who has this? And then that would be the most common scenario.
And response time, what response time right now to eConsults that come your way for the group?
So Heidi will have all the stats, but we're supposed to answer them within a few days, and then can mark it we're away if we're away. I try to just do them the day I get them, or I worry they will pile up. So that's the nice thing from our perspective, is we can do this anywhere. So and some of them are more time consuming than others, but we can certainly answer some of these questions quite quickly, like 24-hour turnaround.
So there is a question in the chat from Dana Russell. Will there be coordination between KHSC Cardiology and the community (APEX) cardiology through eConsult?
Hi, Deanna. Yeah, so I guess, this is primarily done through KHSC. We certainly have an excellent relationship with the cardiologists at APEX because they trained with us. And a lot of the testing is done in both sites, really just trying to optimize the wait times for the patients. So I don't have a formal communication after I do an eConsult with anyone really, other than the primary care physician. I'm not sure if I've answered your question.
Yeah, no, that's kind of what I thought. I was just wondering, because sometimes in the community, it's a toss-up, like, do I send them to the hospital? Do I send them to APEX?
Right.
And so I was wondering, if we send an eConsult question in, would there be a mechanism where a KHSC cardiologist might suggest APEX as a more timely referral, or like just trying to figure out how to coordinate
right
those two?
Yeah, no, that's a good question. I think that to me, the question is, who can see the patient soonest with the best outcome? So that's one of the things about eConsults, is if I see one like the example I gave, where the patient likely needs a procedure, I would say refer to Dr. X. If
Right.
they really need a general assessment, then we have people who will do that, and APEX has people who will do that, the heart clinic. There's lots of options now in the community, which I think there are so many patients to be seen. I just like to keep that patient centered and say, whoever can see this patient should see this patient. But I'm not personally centralizing all of that. If I can centralize KHSC, I'll be very happy.
Excellent question. Thank you for that. So, I think the question that I asked before Dana's question was around time to response. So how long do you find it typically takes the group to respond to an eConsult?
Heidi, do you have more details, or I personally try to do it in 24 hours.
Oh, you're on mute, Heidi.
24 hours is amazing. So the service level that specialists agree to is 7 days, but our the Southeast average is just over 2 days, and I would say that cardiology is definitely meeting that 2 days average as well. So it's a great response time in reality.
Excellent. So it sounds like you're getting eConsults, but you'd be happy to see more of them coming your way.
For sure. So we did 200 in the last 12 months, and we have capacity to increase that by quite a lot. Hard to give you an exact number because I don't want to speak too much for my other 4 colleagues, but certainly we could increase it quite substantially. Yeah.
Great.
I'm very interested to hear feedback from anyone in the group. If you just want to type it in the chat, even as to, do you find this helpful, or how could we be more helpful in our response? I don't think it's helpful if every time you put one in, the answer is the person needs to be seen in person, full stop. There has to be some streamlining of like, do this test and that test before in person. Because if everyone is, this person needs to be seen in this patient needs to be seen in person, then I would argue that there's really no point in doing the eConsult. It has to be something that you think would help streamline the experience.
Right.
For everybody.
Excellent. Dr. Russell?
Just to give some feedback, I haven't e-consulted cardiology in some time now, but I use eConsult a lot for many different questions. I used to sort of send the referral and put the question, do you think that this would be something you should see, or what should I order before you see them? And this just makes it a lot easier, and especially for you know, the different specialty divisions that don't have central triage, having a name to refer to with a background on the eConsult that says just order like a 7-day Holter and refer to blah, blah, blah. It's so much easier than referring and getting something back. This would be more appropriate for blah, 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 and doing that whole daisy chain. So anyway, nothing but thumbs up.
Excellent. So it sounds like from a process perspective, you send the eConsult first, you wait for the response, and then that drives your next step.
Well, not always, because some of them are slam dunks, you know, and some of them have already a previous relationship with a certain cardiologist and so on. But certainly for the novel patient, or the patient that maybe hasn't been seen for 10 years and has new but different symptoms, or that type of thing, and there's any question about, you know, what would be the most appropriate test or something, it's very useful in those cases.
Excellent. Excellent. That's useful feedback. So what kind of documentation comes with those eConsults, Dr. McLellan, and what would you like to be seeing?
So what I like the summary sheet from the primary care practice is helpful with all the medications. That's really helpful, and just the sort of the bottom line problem list for the patient in general. The testing comes through the PDF, easy to open, echo and ECG. One thing that doesn't work well is if the ECG that we're trying to look at is just a verbal report, it isn't the actual tracing. That happens, I find, sometimes when patients have been in a hospital, if they've been in the Belleville Hospital, for example, and the family physician just has their verbal report. But really it's the imaging, but it seems to come through well.
Right. And have you had situations where there's been a back and forth exchange through eConsult?
Definitely. So we've done that a few times, and I've found sometimes my advice is, you know, I would suggest A, B, and C, and then let me know. And that has been great with things like a patient who is elderly and has multiple issues and maybe needs a pacemaker, but we're all trying to reduce the time that the 85-year-old has to come out in January for tests. So I suggest a test, it's done. And if it shows they need a pacemaker, then I just direct that to the pacemaker group and it gets done. So there are good examples, I find, particularly for complicated, frail patients who genuinely find it difficult to come in. I do think that the back and forth has then been very helpful.
Excellent. Excellent. And when so I think, and I'm looking to Heidi as well, I think there's more than one cardiology group that you can send eConsults to as our effort to triage. And I think you sort of talked about that earlier in your presentation.
Yeah, so you can direct the consults to interventional or arrhythmia. And certainly like arrhythmia right now, I understand is getting about 2,000 consults a year. Not by eConsult, but for clinic. So that's an overwhelming amount. And many of those could initially be certainly answered by cardiology group on eConsults. But if there's a specific arrhythmia question, the group is there. They're happy to do consults. They would like to do more eConsult to try to streamline their clinic. So you can certainly choose arrhythmia. If you choose cardiology and we think it needs a higher level arrhythmia, we will help with that too. So you really can't go wrong, to be honest, if you start with cardiology. And if you look at the names on the list, the reality is that 3 interventionalists are doing cardiology and interventional. So you should get the answer that you're looking for. But if you specifically have a subspecialty question, for sure, do the interventional or the arrhythmia. It's certainly available.
And people are welcome to contact you directly through, and I always think about eConsult as 2 doors. So you can pick direct to specialist, which is where you know who you want to contact, or you can go to the managed group where you don't know who to contact.
Yeah, I think that's a great option. And it also, particularly, for some of us who've been around for a while, there are patients that we might have seen 15 years ago. And it's usually nicer for the patient to talk to the same person or to see the same person. So you can certainly try to access it that way. To just get that initial testing advice. Not everyone in the division is on the eConsult list for various reasons, but certainly if you say this person was attached to Dr. X for 10 years and what do you think, we could at least give some advice and say, we should suggest test X, Y, and Z and then refer them back to Dr. X.
Great. So maybe I'll just pause and see if there are other questions or comments for our participants on the call this morning. We certainly welcome your feedback. A quiet group this morning. So are there people that end up seeing you in clinic and you say, if only this person had an eConsult first, it would have?
Yeah, so, and my personal clinic is a bit skewed to the procedural side for intervention. And so there are certainly patients that I see in that clinic who I could have predicted ahead of time that they need X, Y, and Z. And then we would do it ahead of time and it would save them a second trip. But often, and I think it really depends on, the referring care provider's comfort with what the patient is presented with. Generally cardiology still relies on the physical exam. We can't do it all by echo and Holter. We need to talk to the person and I don't think our message here should be that we're trying to replace our in-person visits, because I'm really not a fan of phone medicine and virtual medicine for new patients. I think that just doesn't work in cardiology. But it's certainly when there are just questions or there's a test review, and then to streamline the process for when they do get to see us, I think that is the huge advantage of eConsults.
Right. So it sounds like it's almost expediting care, because by the time they get to you, right.
And allowing us also in the cardiology group to direct the patient to the person that we may know, but the referring person may not know. We know that this doctor does that procedure, and the likelihood is this patient either needs it or needs to be told they don't need it. So I think it's one visit, not 3.
Right. And are you also finding you're getting questions about like how to manage the patient while they're awaiting to be seen by a specialist?
Yes, that's another great point. We are getting those questions about, what should I do before they get the test, and should I change this medication ahead of time? So there's a lot of that. And I do find I've also said a few times, why don't we try this? And if they're not better, then send this 85-year-old to see me. But if they're better, I would leave it. If the referring physician or NP is comfortable, then I think that's great. I think it really does promote a better back and forth, because all of us are difficult to find on the phone. Right. So, and you can answer this if you're on call and you're here at 2 a.m, you can answer it if you want to. But it doesn't matter when you answer it. That's the beauty of it to me.
Excellent. So it's user-friendly from your perspective too.
For sure. And we're not, trying to clog the family practice phone lines that are already overwhelmed.
Yeah. So other questions or comments? Great opportunity to talk to Dr. McLellan today. So a quiet crowd on this snowy Friday.
Yeah.
So it sounds like you're new really to eConsult, having done it for the last couple of months, but you've had colleagues that have been doing it for quite a while now. I know that Dr. Redfern, who's an EP side of the business, is a strong advocate.
Oh, for sure. And it's a great way to help the arrhythmia side of cardiology streamline their referrals. It's a fantastic way to do that because a lot of their questions are, what is this Holter telling me? Or what is this ECG telling me? Do I need to be worried? Or can I just not do anything? And so if they can answer that in an eConsult, that's amazing.
Right. And
primarily for the patient, they get a quick answer.
Yes, exactly.
Yeah.
And is there any concern about their place in the line as it relates to the referral if they send an eConsult, or does that process continue to flow?
No, the process flows. I mean, the wait times are long anyway, so this helps to streamline it because if I get an eConsult that sounds like this person needs a pacemaker very soon, it actually speeds it up. I think this only helps to expedite it.
Okay. So it could also, I guess, almost identify somebody that's very high at risk, maybe in triaging where they are.
For sure. And I think that if somebody's really unwell, then I think it's better to phone the doctor on call and get them expedited that way. But if they're not sure and they can wait a few days to get an answer, then that is a great use of this. That's particularly beneficial for patients in Southeastern Ontario, particularly Kingston, actually, because we can bring them to us very quickly. It's a little bit different than if they're in another region in Ontario.
Right. The advantage of being in the Southeast.
Yeah, exactly. One more advantage.
Exactly. All right. Anything that we missed that you think we should touch on briefly as we're winding down this morning?
No, I think it's great to just have a chance to understand if this is really helping, and if people think of things later and they would like to feed that back to me or to anyone on the CMO Consult team, happy to take that because really this is a work in progress. I do believe there is room to increase. So we will strive to keep our quick turnaround time of 2 days, and happy to have more feedback. And I hope to be able to tell you in the next year or so that we have managed to centralize our referrals. And I'd like to somehow merge that with this service because they're really both could be very complementary.
Right. And there is work happening with respect to the Ocean tool that many of the primary care providers are familiar with in terms of the e-referral tool and the potential moving forward of actually using that tool for eConsult as well. So if you get an e-referral, being able to convert that to an eConsult or enrich the experience through eConsult in parallel to e-referral. So we hope to see that rolling out later this spring.
Great.
Excellent. Well, thank you very much for being with us this morning and for everybody that joined us on the call. Our next session will be on March the 25th, where we'll be talking to Dr. Lawrence Hookey about gastroenterology.
Thank you very much.
All right. Take care. Be safe, everyone.
Thanks.